I am so honored to have been asked to present the welcome note to the conference, The Power of Oncology Nursing. At the time of this invitation, I was so inundated already with numerous keynote speeches during this very week, but I did not even for 1 second, hesitate to accept this prestigious invitation. Why? Not just because it so happens to be the year of the midwife and nurses, but also because as a mother of a cancer survivor, I know all too well the value of our nurses, let alone oncology nurses. We, as a family, experience firsthand the professionalism and dedication of our wonderful oncology nurses, consistently delivering care with love, compassion, and empathy, making us feel every day that we were at the center of it all. What we now call patient-centered approach. Having spent many months at a time in the hospital with our son, I witnessed the grueling schedule of our nurses, as well as the huge number of complex tasks that they actually perform. As someone aptly said, nurses are like icebergs. At any one time, you are only seeing about a fifth of what they are actually doing. The appreciation of our nurses on a societal level is there. We all view our nurses as wonderful carers, and we even call them angels. But unfortunately, many governments and the current global health systems values our nurses only on a superficial level. It took a COVID-19 pandemic to finally showcase the real and indispensable value of our healthcare workers, including nurses, for our societies. Showcasing the glaring fact that 70% of healthcare workers in the world are actually women. I repeat, 70% of healthcare workers in the world are actually women, which means that global health security rests on the backbone of these women that hold up our health systems and glue them together. And yet it took a nasty pandemic to further showcase the undervaluation of healthcare workers and especially nurses. The fact that nurses that are also 90% happen to be women hold less than a third of senior positions, and that they are overworked, underpaid, and unprotected. A complex disease such as cancer is also a great revealer of gaps in a health system. One such gap is the underestimation of the power of oncology nursing, especially in low-middle income countries. Nurses in low-middle income countries are even less appreciated than their counterparts in high-income countries. They are also underpaid, do not have access to higher training, and certainly do not have a seat at the policy table. If we are to face the increasing global burden of cancer successfully, we have to embrace the fact that the cancer fight requires the collective action of many stakeholders. Healthcare professionals caring for cancer patients, including doctors and nurses, cancer patient advocacy groups, governments, international health agencies, global funders, academic institutions, NGOs, plus other key stakeholders and influencers. Each stakeholder is as valuable as the other, reminding us all that health systems, and I emphasize here the word systems, by definition, are blind to the traditional hierarchy placed on healthcare workers, especially nurses, who are often placed at the bottom of the totem pole. After all, systems are held together by numerous nuts and bolts. A weakening of one would collapse the whole system. Our strength is not where we are on the human resources ladder, but it is in our togetherness. And we need to embrace that fully now, especially given the fact that the cancer community has taken a beating due to the diverging of focus and resources away from cancer and from most other health issues towards the coronavirus. There is no time to waste, as we also have lots of catch-up to do. We know also that there is 18 million shortage of health workers all over the world. And we know that oncology nurses are a scarce breed, especially in low-middle income countries, as training and recognition of cancer nursing is not available in many low-middle income countries. The cancer nursing workforce reflects challenges in nursing in general with regards to recruitment, retention, burnout challenges throughout the world. The thing is that nurses who are not well trained to care for patients with cancer not only face overwhelming responsibilities without the requisite knowledge and skills, but their lack of training also directly affects patient safety. I repeat, it directly affects patient safety. This is serious. Nurse and patient safety are fundamental for oncology programs worldwide. Furthermore, trainings for advanced practice nurses in oncology that provides role models for high quality expert care are also lacking in many countries, thus missing a great opportunity for health systems to be carried up by such expert professionals. Despite these challenges, we have identified actions by cancer nurses in low middle income countries to problem solve and take the initiative to advocate for policy changes, such as on opioid, prescription, and tobacco control. These nurses will present their stories today. We will also hear today about nurses saving lives through leading and implementing prevention and early detection strategies, not only on tobacco control, but also on breast and cervical cancer screening programs. Nurses also help to enable and empower people to self-manage where possible, thus improving the quality of life of patients through their supportive care, which is the central pillar of cancer nursing. We will also hear from a cancer survivor from Ghana in that regard. It is time for all governments and health leaders to recognize globally that cancer nurses make a huge positive difference to cancer care worldwide. They are the glue that connects the critical cancer case care pathways together. Governments and health leaders have to realize that the successful achievement of the UN 2030 Agenda for Sustainable Development, calling for a third reduction in mortality from NCDs by 2030, will not be achievable without our oncology nurses. Neither will our aspirations to deliver universal health coverage. Our nurses, including oncology nurses, are professionals equipped with the very skills that are needed to strengthen a health system so that it can deliver universal health coverage or to fight a pandemic. But for that to happen, nurses and oncology nurses, as frontline workers, have to have a seat at the table at those international decision-making and policy board meetings. Yes, we all did the clapping for our health workers, including nurses, and we all meant it from the bottom of our hearts. Health workers and nurses deserve this symbolic appreciation, as nurses are putting their lives at risk for the sake of saving all of us. Health workers have truly given a new profound meaning to the term the ultimate sacrifice. Perhaps it is too early to see how this symbolic appreciation will actually translate into a real tangible appreciation, given that we are still in the middle of the pandemic. I would like to see in the very near future if, for example, there will be a significant shift in how we compensate our nurses commensurate with their worth, or whether we see an enactment of more formal policies facilitating and encouraging nurses to reach leadership positions, or whether there will be more appreciation of migrant nurses who leave their countries and families to take care of our own. Beyond the theatrics, we need to call upon government and public leaders to go beyond the clapping, to appreciate the value of our nurses by prescribing the following: fair pay, fair chance for training and promotion, fair chance to be heard on the policy table, and fair and safe working environment. After all, we have seen what political will can do. If whole countries can be locked down, then support for healthcare workers and nurses can be done with a stroke of a pen. That is, if the political will is there. We all need to call on development partners, donors, international financing institutions to focus development assistance on strengthening nursing education and employment, especially in low, middle-income countries where domestic resources are constrained. And this would be the greatest investment, as nurses are already leaders, advocates, innovators in their communities, health centers and hospitals, delivering empathetic professional care day in, day out, despite extremely challenging circumstances. What we need is the rest of the world to actually have the intelligence to see this great investment and to place the right value on this untapped potential. Once done, we will all receive the ultimate dividend. A buttressed and resilient health system that actually cares and respects all of its workforce, be it women, men, migrant workers, and one that leaves no one behind. So again, congratulations on the International Year of the Nurse and Midwife. It gives me great joy to set up this conference. Thank you so much for giving me the chance to speak to you today. Enjoy the day, and thank you very much.